Welcome to the Explainer. You know, when most people think about ADHD medication, they probably think of stimulants, right? Things that kick in fast. But what if I told you there's another way? Today, we're going to break down Atomoxetine. It's a completely different kind of medication that aims for a steady, all-day focus, and it works on a totally different principle.
All right, so let's just dive right in with a question that a lot of people and their doctors have to grapple with. Stimulants are, they're the first line of defense for ADHD, but what happens when they're just not the right fit for you? Maybe the side effects are just too intense, or maybe there's a real concern about the potential for abuse. So what do you do when the main tool in the toolbox is off the table?
In this chart, wow, it really lays it all out, doesn't it? On one side, you've got your stimulants. They're all about a fast onset. They primarily hit the dopamine system, and yeah, they come with a higher potential for abuse. But then look at the other side, Atomoxetine. It's the complete opposite. We're talking a slow buildup over weeks. It targets a totally different neurotransmitter called norepinephrine, and it gives this smooth 24-hour coverage with a really low abuse potential. I mean, it's two completely different philosophies for tackling the same challenge.
Okay, so here's how we're going to break it all down. First, we'll talk about what makes this a new approach, moving beyond stimulants. Then we'll get into the cool science of how it gives the brain a targeted boost. After that, we'll cover the practical stuff. Who's it for? What's it like to take it? Then we'll look at the risks, because that's super important. And finally, we'll wrap it up with the big takeaway.
All right, let's jump into part one, Beyond Stimulants, a new approach. And really, this is key. We're not just talking about swapping one pill for another. This is about a whole different way of thinking about how to treat ADHD.
Okay, so what is Atomoxetine? Well, its official name is a bit of a mouthful. It's a selective norepinephrine reuptake inhibitor, or an NRI for short. Yeah, I know, it sounds super technical. But really, the two words that matter here are norepinephrine, that's the brain chemical it targets, and, of course, non-stimulant. Right away, that tells you this is playing a whole different ballgame than something like Adderall or Ritalin.
Now, you've probably heard of it by its brand name, which is Strattera. But okay, enough with the names. Let's get to the really cool part. What is this stuff actually doing inside your brain?
And that brings us to section 2, the brain's targeted boost. We're going to unpack the really unique neurochemistry behind how atomoxetine actually works.
So everything we're about to talk about happens right here, in the prefrontal cortex. This is basically the command center of your brain. It's the CEO, the part that handles all the executive functions like paying attention, controlling impulses, and staying organized. With ADHD, this command center can be, let's say, a little under-resourced. And that's exactly the area these medications are trying to support.
Okay, to get how this works, you have to understand this one key player, the norepinephrine transporter, or NET. Think of it like a tiny recycling vacuum in your brain. So after a chemical called norepinephrine sends a signal between brain cells, the NET's job is to swoop in and vacuum it back up. It's basically the brain's cleanup crew getting things ready for the next signal. So here's the magic. Step 1, norepinephrine gets released to send a message. Normally, step 2, that NET vacuum would just suck it right back up. But, and here's the key, step 3, atomoxetine comes in and basically jams the vacuum. It blocks the NET. So what happens? Step 4, all that norepinephrine just hangs out in the space between the brain cells for longer. And by doing that, it boosts the signal, making it stronger and last longer. That's how it helps with focus.
But wait, it gets even cooler. This whole process of blocking the vacuum cleaner, well, it has this really clever side effect.
It gives you a targeted dopamine boost, but only where it's needed. See, it turns out that in the prefrontal cortex, that very same vacuum, the NET, is also responsible for cleaning up some dopamine. So when atomoxetine blocks it, you get this bonus effect, a little bump in dopamine, but only in the brain's command center. It doesn't flood the reward pathways like stimulants can, and that's the secret sauce. That's why it has such a low potential for abuse.
All right, so the brain chemistry is super interesting for sure. But let's get practical. What does this all mean for an actual patient? Who is this medication for, and what's it really like to take it?
Well, because of how it works, it's a really good fit for certain people. For example, if there's any history of substance abuse, or even just a concern about it, this is a much safer path. They can also be a game changer for people who have coexisting anxiety or tics, because sometimes stimulants can actually make those things worse. And of course, it's a solid option for anyone who's tried stimulants and they just didn't work out, or the side effects were just too much. That desire for smooth, 24-hour coverage is a big one too.
Okay, this is probably one of the biggest differences, and it's so important to understand. Patience is key. This is not a stimulant. It doesn't kick in after 30 minutes. It's a slow burn. You start on a low dose, and you might start to see some early improvements in the first month or so. But to get the full, real therapeutic benefit, you're probably looking at 6 to 8 weeks, maybe even longer. You have to let it build up in your system.
All right, and of course, with any medication, we have to talk about the other side of the coin. So now we're going to get into a different set of risks, and it's really important to understand the side effects and warnings.
And we have to start with the most serious one. This is an official FDA black box warning, and you have to take it very, very seriously. It says there's an increased risk of suicidal thinking, especially in children and adolescents, and especially during the first few months of starting the medication. This means it is absolutely crucial for parents, patients, and doctors to be on high alert, just watching closely for any changes in mood or behavior.
Okay, now for the more common stuff. These are the side effects you're more likely to run into, especially when you're just starting out. Things like nausea, an upset stomach, that's a big one. Also, feeling kind of drowsy or tired, dizziness, dry mouth, and maybe a slight bump in blood pressure and heart rate. The good news is, for a lot of folks, these tend to get better or go away completely after the first few weeks as your body adjusts.
And finally, there are a few rare but very serious risks that you just have to know about. Things like severe liver injury, so any signs like yellowing skin or eyes, are a huge red flag. Same with any serious cardiovascular events like chest pain or fainting. And, for men, a condition called priapism. Any of these, they are not a wait-and-see situation. They require immediate medical attention.
Okay, so we've looked at how it works in the brain, who it's for, and the risks involved. Let's pull all this together for our final section, the non-stimulant takeaway. What is the big picture here? Where does atomoxetine really fit in?
And honestly, this table does a great job of summing it all up. You've got some really big points in the pros column. The low abuse potential is huge. That smooth, 24-hour coverage is a major plus for many, and the fact that it can help with things like anxiety and tics is a fantastic bonus. But you have to weigh that against the cons. The slow onset is a big one. You have to be patient. Those initial stomach issues and fatigue can be a hurdle. And of course, you absolutely have to be mindful of those rare but serious risks we talked about.
And that really leaves us with this big, thought-provoking question, doesn't it? Is a targeted, non-stimulant approach like this the future of personalized ADHD treatment? What atomoxetine proves is that there's more than one way to approach the neurochemistry of ADHD. And you have to wonder, as we get smarter about the brain, are we going to see more of these highly specific, tailored medications? It really makes you think about where the future of this kind of treatment is headed.